All right, good morning, everyone, and welcome to Health Talk. I'm Peter Christian, again sponsored by Providence Health and Services, Western Montana. And we do this every Monday, ladies and gentlemen. And joining us here in the studio this morning is Dr. Rob Stenger. He's an MD, and he's with us coming from a long way away, way up on at the end of Reserve Street, right? From the family practice facility, right? Tell us about that.
That's right. My clinic is up at Grant Creek Family Practice. Mm-hmm. It's one of the Providence primary care clinics. It was rough, the traffic coming down Reserve Street this morning. I'm a native Missoulian, so it's hard for me to get used to actually having traffic in Missoula, but that's where we are these days.
All right. Tell us a little bit about Rob Stenger. Where are you from? Tell us about how you got into medicine and how you be able to take care of all those needs up at Grant Creek.
Sure. So I'm a Missoula boy, born and raised. I'm a Hellgate High School grad, and didn't know what I wanted to do when I left, but along the way, kind of came to medicine as what I wanted to do for a career, and ended up going to medical school at a place that does a lot of specialty care, Johns Hopkins. But during that process, got really interested in primary care. Did residency training in Portland, and then decided to come home to practice. The things that attracted me to going into primary care are some of the things that we're going to talk about today. It really being an opportunity to make healthcare better, to take care of people over the lifespan of their lives, to make some real changes that need to happen in our healthcare system to make things better. One
thing I did notice that several years ago, about 10 or 12 years ago, there was a big push to try to get more family practice physicians, more the folks who do what you do, involved and get into medical school to pursue that, where a lot of folks were getting into specialties and that sort of thing. But fewer people were doing what you're doing, and so you kind of set a trend here, right? Yeah. So how is it going for you?
Well, that's still a big push. This is a marathon, not a sprint.
Sure.
But I think part of what we need to do in getting more people into primary care is think about things a little bit differently. I mean, we've really moved past the days of the solo doctor out there doing it in their own office under their own shingle. Marcus Welby, I'm sorry to say, is dead. Mm-hmm. And so it's really about in primary care building that team of people. It's not just the doctor, but it's the nurses in our office, it's the pharmacist, it's the behavioral health specialist, it's the social worker, and all of us together working to kind of meet the needs of the patients that come to see us.
Now, in my conversations with Mr. Fee and the other professionals that work with you folks, what they're trying to make it is make it all patient-centered, right? Is that kind of the whole idea behind the medical home concept?
I think it is, and medical home's the new buzzword, right? Yeah. But it's in terms of what we do in primary care, it's sort of what we've always tried to do. It's just that it's been hard sometimes because of the many changes that happen in healthcare, the way things are paid for and that sort of thing. But what we're always about is trying to meet the patient where they're at and provide for all of their healthcare needs. And in primary care, we want to be able to do 90% of that for most people, because the reality is most people are either healthy and need routine preventive stuff, or they're sick, but with common things like diabetes and high blood pressure that they don't necessarily need to see a specialist for until something goes wrong. And we take care of those routine things all the time in primary care, and we want to be able to provide all of that care so they don't have to go 10 different places in the healthcare system.
I wanted to ask you about that because I'm a pretty healthy guy, okay? The only problem I have is a little bit of bad skin, so I don't really have to worry too much about getting a specialist. So I have a primary care provider, somebody that I see maybe once a year, once every other year, unless I fall and break something, So do you recommend that everybody in the family have a primary care provider, or can it be one person for a whole family?
That depends on kind of family preference. So I personally am a family doctor. I take care of everybody. I love seeing kids all the way on up to my geriatric patients. For some families that works really well. For some families, the woman in the family might want to have an OBGYN manage most of her health care. There might be older folks that see an internist. There might be kids that see a pediatrician. So I don't think it's important to who the particular provider is, but I do think it's pretty important that everybody ought to have a primary doctor or primary care provider of some kind that they see regularly.
Well, especially when there's so many facets to healthcare, it's nice to have somebody that has the whole record from the start until today, right?
That's correct. And that's one of the things that healthcare has gotten a lot more complicated. And I think that's one of the reasons that it's more important than ever to have a primary doctor. It used to be that people would just go see a doctor when they were sick or when something went wrong with an illness that they had. Now there's all sorts of things that we're supposed to be doing and keeping track of in the background to keep people healthy, whether you're healthy and it's just the 5 new immunizations that you're supposed to have, or you're sick and there are the 5 things about your chronic disease that we're supposed to be monitoring and keeping track of to make sure you don't get sick, don't get sicker.
So a primary care physician such as yourself, doesn't matter what's wrong with me, I can use you as a starting point, and then you can help me get through the system to send me to specialists if I need them.
That's exactly right. And that's part of our job, is to help navigate and figure out, where somebody needs to be and what the particular problem is. And, think about taking your car to the mechanic when it's making the noise. You don't want to go see the transmission specialist if the noise isn't the transmission. You want to see somebody that's a diagnostician first to help figure out what's going on, and maybe your general mechanic fixes it. Maybe they send you to somebody that's a specialist in the electrical system or the transmission or whatever it is. But we play that kind of first line role in primary care.
Well, doctors, my gears have been grinding really badly. So no, seriously. So when someone comes in to see you, then tell me about that initial consultation for someone that you're seeing for the first time as a family physician.
Sure. So we do a lot of things that you would expect, of course. I mean, we review medical history and medications and talk about why that person's there. A couple of things that are sort of not necessarily new with the medical home concept, but that we try and do is, assess really where that person's at in terms of looking at all the guidelines and what health care they might need. You didn't come see me for a colonoscopy today, but we're going to talk about it if you're a new patient. If you need a colonoscopy.
Okay.
And another part of what we do is really try and provide some orientation to the healthcare system about who we are and how a patient that's new to our practice might use the healthcare system. So when I see new patients, I tell them, you can get online and email me online. You can request medication refills. We have same-day appointments in our office, so you don't have to go to the emergency room or the urgent care when you're sick with things. We have doctors on call after hours, so if you have urgent questions, we can get those addressed. And then setting up some sort of a follow-up plan. You're healthy, you're on the come see me once a year plan, or we've got some things we need to track, and you're going to come back and see me in 3 months. Sure. We're
going to take a little break. By the way, if you have a question for Rob Stenger, he's an MD, of course, and he's helping out. Actually, he directs the Grant Creek Family Medicine, which is part of Providence, St. Patrick Hospital here in western Montana. One of the many ways of reaching out to the community and providing perhaps a little bit more local care to individuals and families. If you have a question, give us a call, 721-1290 or 1-800-568-5309, or you can direct your question to our Facebook page, and we'll be right back. On Talkback, 721-1290, 1-800-568-5309, our numbers. And Rob Stenger's already taken some calls from people. I've actually visited with them one-on-one. I'm very impressed. Thanks for doing that.
Well, and I should say probably if you're calling for medical advice on the radio is not the right. We're talking about big picture stuff here.
This isn't Dr. Dean Adele, okay? It hurts when I do this. Don't do that, right? Yeah. So, okay, let's talk a little bit more about technology.
Sure.
Because I know that in today's world, if you can't tweet it or email it or whatever, then there may be some upgrades that have to happen. What kind of things do you folks do at Grant Creek and of course at Providence to make it easier for people to access health care and without actually having to come to the doctor or over and over again?
Sure, that's a great question, and I think in primary care, when we think about medical technology, we tend to think about the sexy new medication or the new device or the new surgery that I'm going to get. In primary care, I think the revolution has been around more the information technology and how we use it. So there are pieces of that face the patient. We now have a portal where patients go online, they see their lab results almost as soon as I get them in my office. Wow. They email us with questions back and forth, and that really allows us to stay in touch in a different way. When I'm monitoring somebody's blood pressure, I can say, send me an email and send me 10 blood pressures in the next 2 weeks, and we'll figure out how to adjust your medication, rather than that being a follow-up office visit. So that's one thing. those patient-facing technologies, the ability to get in touch with us and request refills and schedule appointments online. Then there are sort of the healthcare provider-facing technologies. So, I was talking a little bit before about there's so many things now that we have to track and keep track of. I'll use diabetes as a common example. There are probably 20 clinical practice guidelines that I should be following for my patients with diabetes to keep them healthy, whether that's checking labs or monitoring immunizations. We now have in our medical record kind of dashboards where Mrs. Jones shows up in the clinic and her dashboard shows up and says, here are all the areas where she's green and doing well. Here's some areas where we're red. And, sometimes that's things that I need to work on with my patient. Sometimes that's things that we just need to remember to do. You didn't get your flu shot and you have diabetes. It's really important that we do it today. And so that sort of information technology just helps us keep track of the masses of information that we're having to handle, especially in primary care.
I think one of the things that I've been hearing from so many of you folks at Providence, from the top all the way to just the per the nurse serving on the line, is the whole idea that that healthcare providers are reaching out to patients in ways that perhaps the patient hasn't really experienced before. And that's part of the medical home concept, right? And can you kind of explain what that's all about?
Sure. So in healthcare speak, we tend to call that sort of outreach care coordination, if you will. But there are lots of things that we need to reach out and remind our patients about. And sometimes that's, you went home from the hospital. Did you get all your medications, and are things going okay before you follow up in the clinic? Sometimes that's...
You mean to tell me I don't have to call and get that information? You'll call me?
Well, we're trying to be
cool.
more...
I mean, it's great. I mean, it's wonderful.
We're trying to be more proactive about that. Now, we've got to be a little bit careful about that because we don't want somebody to get 4 phone calls. We don't want the ER and the hospital and our clinic and 3 other people, the insurance company, to call you. But, we realize that healthcare is complicated. We know that one of the biggest problems with medical errors are things that fall through the cracks. We've missed something. We forgot to stop a medication that should have been stopped. We didn't get that patient back in for a follow-up appointment. And so to try and be more on top of that, coordinating a person's care to make sure we're not missing things. And that's part of that outreach. We can't just wait for patients to show up at our door all the time.
So at what point, when people come in to see you there in the Grant Creek Family Medicine Clinic there, at what point do you say, you know what, we need to get you into the hospital for certain things, to make sure that you're going to be okay? How do you make that decision?
That's always an individual patient by patient thing. If we're doing our job right, that should happen very rarely.
Sure. Yeah.
And as a primary care doctor, I always feel like a little bit of a failure sometimes when my patient ends up in the hospital. We try and avoid and be on top of those things, but illnesses happen and accidents happen. But that's always a patient by patient kind of thing. Determining what's going on with that individual person and also what resources and support they have at home. A pneumonia that requires the hospital for one person might not require a hospital for another person that has a very different living situation or supports or family members at home, for example.
And I think that's one of the reasons why people are depending a lot more on their healthcare provider these days, because there is such a plethora of medicines and treatments and all sorts of things that we really can't keep up. So we kind of depend on you to do that for us, right?
That's absolutely right. And that's sometimes challenging because, especially in my world, it's sort of knowledgeable about many areas but master of none, right? So, the patient coming in with a very detailed question about their pancreatic cancer, I am, unashamed to say, what, you've read a lot about this. I know some things, but I need to hit the books and look at the specific question you're asking me because sometimes I don't know the answer.
Now, have you guys been able to do the research, and I'm sure you have because you've done a lot of research into this medical home philosophy, at a point when you don't want to be too intrusive on the patient at home calling about this and that and the other thing. And I'm sure that there are people who maybe they want to tell you, I really appreciate the call, but I really don't need that. I mean, do you run into that every now and then?
We do sometimes. And one of the things, part of the sort of concept of the medical home is we do a lot of measurement of ourselves, both measurement of quality and measurement of what patients think.
Right.
And that's really important. We call it the patient experience measure, not just were they happy with the visit, but do they feel well cared for? Do they feel healthy? So we're always tracking those sorts of things. Maybe not as specific as did you like it when we called you to remind you about your flu shot? But
Sure.
What we've seen as we are doing this work is that in general our patient experience scores go up. Patients are happier. They're feeling like the whole package of services is good health care for them.
Now, when I come in, I've got my insurance card, or I've got my affordable care insurance, that sort of thing. How do you guys handle that, or is that something I'm on my own for? How does that relationship work with trying to make insurance pay for all this?
So in terms of just the mechanics of it, the front staff in our office handle the insurance information. I as a doctor try never really to look
Sure.
at somebody's insurance with the exception of knowing, are we doing a treatment that you're going to be able to afford or is going to be paid for?
Right.
But that's one of the things that's changing about health insurance in general and how we pay for health care. We've tended to pay for things on sort of what they call the fee for service. You go to the hospital, you get a Tylenol, you see the line for Tylenol on your bill, or you go to the office and you get an immunization, you see that line. And we're trying to switch to paying for sort of more fee for value. What kind of outcomes did we produce, and were they good for that population of people? So at the higher level insurance end of things. What that means in primary care is that we're adding funding to be able to support some of those other things, the pharmacist or the behavioral health person in our clinic or the extra nursing staff to make those phone calls. Those aren't services for which a patient's ever going to get a bill. Mm-hmm. So we need to figure out how to finance those in different ways.
And that's more of an internal thing, right? So, yeah.
Correct.
We're going to come right back. If you have a question or comment, give us a call, 721-1290. Dr. Rob Stenger joining us here this morning. He's the director of the Grant Creek Family Medicine, part of Providence Health and Services. We'll be right back with more of Health Talk right after this. We are back on Health Talk right here on Newstalk 1290 KGVO AM and 101.5 FM. Joining us here in the studio is Dr. Rob Stenger. He is the director of the Grant Creek Family Medicine, and we're getting to the point now. Got to get into the nitty gritty of how to get in touch with you, and so primarily when you talk about primary care, who do you want to come to your clinic?
So everybody, really. Okay. I wish actually we had enough room at our clinic to take care of everybody in Missoula. But I think everybody, if you don't have a primary care provider that you're seeing, everybody should look into getting a primary care provider. And ideally, a clinic that's thinking about some of this medical home stuff that we've talked about. Kind of, it really is the future of how we're going to practice primary care and integrate with the rest of the healthcare system.
Okay, so basically, we've got everybody who wants to stay healthy. They need to come see you. Or now, are there other clinics that are associated with St. Pat's here in town?
So there are. Here in Missoula, we have a few other great primary care clinics. We have the Women's and Family Care Center. We have Broadway Internal Medicine and Montana Internal Medicine. And then we have clinics down the Bitterroot in Stevensville and Florence as well.
Right.
And we tend to work as a big family. All of our clinics kind of do this work together.
And do they all provide pretty much the same family care services?
Yes,
Primary
with the
services?
exception of the internal medicine clinics.
Right.
And then at our clinic, we're starting pediatrics as well. So in addition to the family doctors, we have one and soon to be hopefully more pediatricians that are working with us.
So basically, if I move from one part of the town to another, I'll go to one clinic that's closer, and you'll be able to access medical records easily and electronically, right? That's seamless?
Absolutely, yep. And that happens every day. I have folks that move up from the Bitterroot to Missoula and come see us, and I can see all the records from their doctor that saw them down there.
So I ask this of all of our physicians and medical personnel that come into the show, is what is it that fires you up about hitting your feet on the floor in the morning and coming to work? What do you love about it?
For me, I really love the patient relationships. That's what does it for me. I mean, I look at the people on my schedule and I'm like, oh, I haven't seen this person in a while. I'm excited to, sit down and have a conversation with them and help them out today. And being in primary care, I get to see people over and over and actually get to know them over time, which is, what gets me excited about getting up in the morning.
So there you go. So now, what about the people you work with? Tell me a little bit about your staff.
We have just an outstanding staff in our clinic. I think that we have folks on the phones, folks that manage things. We have an outstanding team of nurses. I really think that, mean to brag, but I think we have some of the best nurses in Missoula that work at our clinic. A number of physicians, nurse practitioners, PAs that work at our clinic. And then we're adding new members to our team. We have a pharmacist, we have a social worker, we're trying to add behavioral health, trying to, as I said, expand that team of folks that's available to take care of our patients.
All right, let's get some contact information. How do we get in touch with you? Give you an address, a phone number, if there's an email address, fax number, that sort of thing.
Sure. So, it's Grant Creek Family Medicine is our specific clinic, and that's up on North Reserve Street. So I tell people it's across the street from Lowe's because nobody knows addresses up on Reserve. But, that's where we're at. And we actually have one phone number for all of the Providence clinics. It's 1-855-PMG-TEAM. So Providence Medical Group Team. And that you can use that to get a hold of any of our clinics and schedule a new patient appointment or anything else that you'd like to do.
Dr. Stenger, thanks for being on the show. It's been a pleasure, and we look forward to seeing you again sometime.
Thank you for having me.
It wasn't too terrifying, was it?
No, not at all.
All right. Hey, thanks for joining us on Health Talk. We'll do it again next Monday from 8:30 until 9, sponsored by Providence Health and Services in Western Montana. And we'll be back with Talk Back in the 9 o'clock hour.